Joint replacements have traditionally been an inpatient procedure, and in the past they've been very long hospitalizations, sometimes up to a week or so. And so the last few years, we've been looking at how to get patients out of the hospital quickly and have found that there's a lot of benefits involved with doing that.
Outpatient joint replacement basically means that you will have a joint replacement done, whether that's knee, hip, shoulder. You can be at home after your operation that same day in the setting of your own home, bed, eat your own food, and I think people are a lot happier. And one of the ways that we accomplish that is through what we call enhanced surgical recovery. And basically, this is a set of protocols and processes that we utilize to help patients. Things like spinal anesthesia, nerve blocks around a knee or hip, early physical therapy after their surgery. Those are things we use to be able to get patients out of the hospital.
Enhancements in the joint replacement program have been dramatic, especially in the last few years. The robot-assisted surgery has been a big factor in improving our ability to perform this operation successfully and safely. In the robot-assisted surgery, the saw that we use for cutting bone is still operated by me, but it's attached to the arm of a robot. The computer plan tells us exactly where to make the cut, and then the robot arm allows us to have that same level of precision at the level of the cut itself. We're doing less surgery, and because of that, they get a better, faster recovery.
Joint replacement is an elective surgery. It's not an emergency. It's something that we can plan for, and we want that patient to be as healthy as possible before we have surgery. We do a lot of physical therapy before surgery. We want to make sure that your legs and arms are as strong as we can make them beforehand so that it makes the recovery that much easier.
The ability of the orthopedic team at Greenview to help with the patient's surgery and recovery is exceptional. I've been in many hospitals in my career, and I've never come across a team and a staff that's as well trained and well situated to carry out their goals in producing the patient's end result of having a great joint.
I'm very proud to work in Bowling Green, Kentucky. I'm proud to work with the good folks at TriStar Greenview Hospital. I think we can provide good value, a good outcome, do this as a same-day surgery, and make you better so that you can enjoy the rest of your life in a pain-free fashion.